All right, let me see. So I'm live. Let me make sure this is going to YouTube. Okay, YouTube is live. So I'm going to announce this over on my original channel. That's my largest channel. So that's kind of like my antenna. So if people want to watch this over there, they can take a look. Let's see. All right, I shared that over there. So I'm going to go back to my science channel so I can watch all the data come in real time. All right, everyone, I want to stay punctual today. So I'm going to play the intro, and then on the other side, I have a very special guest, and we'll get the interview going at that time. So I will see you on the other side. All right, hello everyone. Welcome back to my channel. My name is Dr. Anwar Youssef Dunbar, and this is Big Discussions 76, Science and Technology. First of all, please like this stream or the playback. If you're watching it on the playback, please share this and please subscribe to my channel. Well, happy Monday, everyone. Today is November 15th. It's my day off from my 9 to 5. So I am streaming over to Facebook as well. So I'm a little selective these days about what I stream over there versus what I stream full time here on my YouTube channel. But I have a special guest today. As you know, in the last couple of live streams, my guests have been from the tech sector. And my hope and goal for this channel is to turn it into a bit of a STEM hub. So if you looked at that intro, I try to, and that's going to evolve over time, but I try to include everything. So you went from the biological sciences to mathematics and engineering and physics, and then we ended with aerospace and astrophysics. So that's pretty much what I want to do with this channel. But I have a guest today who's also from the biomedical sciences like I am. And she's going to talk to us about her, I believe her consulting company, her group, which is in the lab context. But she's going to tell us about that. I won't speak for her. So I'm going to bring up my guest, Nancy Ross, and we will get this discussion going. So here we go. Nancy, welcome.
Hi, hello everybody. Hi, Anwar. Thank you so much for having me on your program.
No problem. Thank you for coming. Thank you for coming. I look forward to learning something, and I'm sure the viewers, whoever watches this, they will learn something as well.
Thank you.
So, all right. Well, I want to be respectful of the time. So you saw the questions that I sent you, and well, let's jump in. So Nancy, thank you for coming to my channel to talk about Improov Labs. For those of you, now many of you are going to find this funny, but I actually know Nancy from the salsa scene. Because
that's right.
you wouldn't think it to look at me, at least, that I would be a dancer. But at one point I was a really hardcore and avid salsa dancer.
I get the same thing.
Really?
Yeah.
Get out of here.
Sure. I think if you know me from the salsa community, you always expect me to be this dancer, but really, I've been a lab person that sort of moved into dancing as sort of a release, a stress relief, if you will. I'm sure we're going to get into a little bit of that.
Mm-hmm. Okay. It's funny you say that. I remember during my thesis defense, I was a part of the Casino Rueda group on campus, and of course there were pictures of us online. And my graduate advisor, when he introduced me at my thesis defense, he posted a couple pictures, and I was kind of embarrassed. I was like, "Oh my God, no one knows that I do this."
You know what? For those of us in the science field, it's kind of like you're leading a double life. I always tell about. It's funny. I was looking for employment one time, and I go into this interview, and I'm all dressed up, and I go in and I'm meeting with the staff. It's one of those interviews where it's like a group interview, so you have to meet with different people. Mm-hmm. And I'm getting halfway into the interview. I'm meeting with everybody. It's going really well. And then the next team that comes in to interview me, the guy was like, "Wait a minute, you look familiar. Aren't you that salsa dancer from downtown?" So he blew my whole cover, and I was like, you know what? Yes, that's me. And, that's what I do. As as a hobby, as a pastime, and this is my career. I'm a lab scientist.
Okay. All right. Well, with that, let's go a little further. Talk about where you're from, and then also how you got interested in science.
Sure. Thank you again for the opportunity. I really appreciate it. So my name is Nancy Ross. I am a laboratory scientist. Also called a medical technologist, is a clinical laboratory scientist professional. And I was always interested in science. When I look in the past, first of all, my family and myself were from the Dominican Republic. My family immigrated to New York probably in the early 90s, I think 91, 92. But way back when I was a child, when I was living and growing up in Dominican, science was the thing. My dream was to be a doctor. I wasn't your typical girl wanting to do girly things. I wanted to dissect insects, and I wanted to understand why this and why that, and very much science driven and interested from an early age. And so the dream was to become a doctor. And that didn't happen. But you know what? I think that life has a way of kind of putting you on the path that you should be. I think I'm cut out to be a laboratory professional, and I'm very proud of this profession. I've been a lab professional for about 20 years now. I think it's going to be 21 years in next April. And I couldn't have asked for a better profession. So yeah, that's kind of how everything got started.
Okay, so talk about your background, what you're training in, and I believe
Sure.
there's overlap in our skill sets.
Yes, yes. A fellow science folk. So when my family immigrated to New York, it was a challenge at first. I had to learn the language, had to communicate, and once I got some foundation on that, and I had my eyes set on my goal, which was getting to the science field, I decided to join the Navy. And so it's in the Navy that I get exposed to the lab industry. They have wonderful programs where you are sent to school and they pay for your education. And in turn, you have a commitment to serve uh, the country for X amount of years. So that's how I was able to reach my goal of getting into the medical field, because I wasn't going to waver on that. It's challenging, when you come to this country as an immigrant and you have so many obstacles in your way, let alone the language, the culture. My family also comes from very humble beginnings and background. So the money was another issue too. So I just had to find my way to get there. I always say that no, was not an option for me. And so I had to find a way to make it work. And the military was that way for me.
Okay, so um, so I know you told me you got your schooling through the military.
Mhm.
Is your area like molecular biology, cell biology,
Sure.
or some mixture of several disciplines?
Yes, a mixture of several disciplines. So I went to laboratory school, so that qualifies you to work in different areas in the lab. So that would be, molecular biology could be one of them, microbiology, hematology, chemistry, what they call a generalist. And if you choose to specialize, then you can do that by going into, one of the disciplines and seeking further specialization. For me, that was I worked as a generalist for a number of years, I think close
Hmm.
to 10 years. So that was anything related to hematology, chemistry, urinalysis, etc. And then I wanted to specialize a little bit and was interested in microbiology. So I did a few years in microbiology labs in different hospitals. And then after that, I went into management and compliance. And that's where I feel like my career really took off when I started getting into the management of laboratory sciences. And currently, I'm working as an operations manager at a large medical center in the Bronx, New York. And most recently, last year, I founded the consulting company called Improov.
Okay. So laboratory school. I've never heard of laboratory school. So that's something that the military
Yeah, no,
has.
they're throughout the country. The military has a really good program. I think a lot of programs are called medical technology, or laboratory science. They have, degrees at different levels. So you could have an associate's in medical technology or laboratory sciences, or you can have a bachelor's degree level, master's. There's even a PhD program that was founded not too long ago. I think I want to say about 5, 6 years ago, if I'm not mistaken. We did not have a PhD track for laboratory, and now we do, which is great. It's important. It's a wonderful career that, we're trying to raise awareness about laboratory sciences and laboratory professionals throughout the country, because we feel that not a lot of people know about us and the very important work that we do in terms of patient care.
Okay. So I'm thinking about your training. So that means you must be very skilled at interpreting, well, determining and interpreting, changes in hemoglobin,
Yeah,
hematocrit,
that's a part of it.
molecular volume, all those things.
Yeah, certainly. That's a part of it. So we are trained in lab school how to analyze and how to perform testing. So, the simple way that I explain it to people that may not be in the field is, when you go to an urgent care, or when you go to any hospital emergency room, or when you see any doctor really, and they order a set of labs, your CBCs, your chemistries, whether they swab your throat and they want to check for strep, or they want to check, how your kidneys are doing, how your liver is doing. All of that is part of laboratory work. So all the blood testing, whether it's blood or any other kind of specimen type, comes to the laboratory, and we have a very organized, designated area where that is analyzed and tested. And so it is because of the information that we provide that physicians and other professionals are able to diagnose and treat patients. So again, really important work that we do in terms of patient care.
Okay. All right. Yeah. So also just for the audience, things like I'm sure you liver enzyme release,
Yep, liver
creatinine,
enzymes, so like your TSH,
yeah,
for your thyroid, it could be your AST.
AST.
Yep, so your liver function panel, your BMP, basic metabolic panel, your CBC, of course, for your white blood cell count, and your RBCs, your red blood cells, your hemoglobin, your hematocrit, your platelets. We diagnose coagulation, or not diagnose, I should say, but test coagulation panels, etc.
Okay.
And most recently, COVID.
Okay.
Which
I
everybody
want
knows
to
about COVID.
Yeah, before we jump into Improov Labs, I wanted to ask you about that because we were talking about that before we went live. But before we talk about what you've been seeing in the last year regarding that, can you talk to us a little bit about what compliance is? Because that's not everybody knows what that is and what that
Yeah.
means.
Sure, it's a great question. So laboratories are very regulated by the laws. So depending on the state that the laboratory is in, there's different regulations that apply. More broadly, CLIA law regulates laboratory testing in the U.S. And so the law stipulates, different aspects that should be in place and that we should abide by in order to produce quality laboratory results. And so most people are familiar with CLIA law. There's different states that have, in addition to CLIA, their own regulatory compliance standards. For example, New York has regulations that are coming from the state side. So, and then I think California is another example. And so that's compliance basically means making sure that the laboratory is abiding to the regulations that are set forth in order to maintain quality operations. And it's a huge field, it's a huge field because a lot of laboratories need assistance with that. It's one thing to run laboratory operations and the day to day just to make sure that you keep the lab running. But at the end of the day, when you get inspected, either by a state inspector or where have you, they're going to come in and see, well, how are you abiding to the regulations? And that produces a report that if you're not doing too well, will have your name on a list you don't want to be in, in terms of citations that are produced against the lab and or the lab director.
Okay, so it involves complying with government and state regulations.
Exactly. And so you want to say that a good laboratory that's producing quality results will keep these things in mind. So when I come in and I ask for certain things, or I check into your process, how's the testing being performed, how's your quality control looking over X amount of months or days, how you're maintaining your instrumentation, how is the competency of your staff, the training of your staff, the onboarding of your staff, etc. All those things will be in place. And if not, then you end up getting citations, which again land you on a list that a lot of people are trying to avoid.
Okay, so for the audience, I'll just add on that when it comes to human health, whether it's in a hospital or if it's a drug company making medications for the general public. All these things have to be, excuse me, all these things have to be closely regulated, because if not, you just don't know what people are doing in there, and what results, extra zero might get added here or there, or standard curve might, they might not be in the linear range of the standard curve, or they might be holding on to samples too long. You never know.
Yeah, definitely. I think, I think you touch on a really important point, is that compliance is really designed to avoid patient harm. So, we want to make sure that we go into different laboratories and we check their operations and that they're abiding to all these regulations. It's not just an exercise in futility. It's just, we want to make sure that if a patient sample ends up in this lab, you will produce quality results and this patient will not be harmed. And so I think that's huge. A lot of what we do, we always take it back to patient care, and we can't lose sight of that.
Okay. So everyone, I don't have a super chat on this channel as of yet. If anyone wants to make a donation to the channel, I'm going to drop my Cash App and PayPal in the comments section right now, if you see fit, if you're watching this live or on the playback. So Nancy, can you tell us a little bit about what you've seen over the last year and a half, or it's been about a year and a half, regarding the pandemic and in the lab setting? What's it been like?
Yeah, I think I was sharing with you, I had relocated from the Baltimore area to New York City around February of last year, without knowing, who knew that we were going to be dealing with a pandemic that hit New York first around March of 2020. And so what we've seen is a lot. Of course, New York being one of the first states, or the first state that was hit by COVID in the US, and my location where I am in the middle of the Bronx, New York, and the populations that we serve, we saw a tremendous hit in terms of the number of patients that were admitted to the hospital, the number of casualties, unfortunately. Some of my staff also was, severely affected by the pandemic. And so that created challenges, not only staffing the laboratory appropriately and making sure that we were handling the increased volume in testing that came in from all the locations that were set up across the city to do massive testing of COVID samples, but also supply chain was affected. I think a lot of folks in the laboratory know this. We had an extreme shortage of PPE, and so that was not unique to us or anybody around the world, really, because who could have predicted a pandemic and the things that we needed to be get ready, right, for. And so a lot of growth over the last year and a half. I'm happy to see New York and a lot of other states, us in general, on the other side. I want to say, now we're talking about vaccination rates, whereas last year we were talking about something else. How many ventilators do we have, or do we have enough masks on hand? And I had to, ration out the masks. My staff could only get so many masks a week. That was the early days of COVID. So it's certainly nice to see us on the other side. Not quite there yet, but definitely long ways from where we were last year.
Did you feel any personal concern working in the lab with specimens and those
for sure. I would be lying if I tell you no. So, those early days when we were trying to understand what we were dealing with, I'm also a mom of two now. When I moved to New York last year, my son was about a year and a half. He's about 2.5 years now. And so, I had several challenges. All daycares were closed. And so in addition to that, just coming home, I remember just taking my shoes off and spraying them with alcohol. And I would say I had a family member take care of my son at home. I was like, hold him in the back, because he would run to the door and like, mommy. And I was like, no, I don't want to touch him yet. So I would run to the bathroom and change and, wash my hands thoroughly and get some new clothes on. And then that's when I would embrace my son. So it was, it's tough times. And I think for all of us in healthcare, a lot of frontline people, EMS and the doctors that took care of these patients in the ICU,
Mm-hmm.
it's hard times for all of us, for sure.
Okay. All right. Well, let's talk about Improve Labs. What made you decide to start Improve Labs, and what do you all do?
Sure. So thank you so much for the question. So Improve Labs is really like a long-term dream I've had of going into different laboratories and doing what I do every day, but a little bit more in an independent way. So founding a consulting company that would go into different laboratories and would help figure out, how different labs are struggling or the areas that they need assistance in, and providing that assistance to them. So Improve is really a nickname that goes back to what has been my passion within my career, and that is process or performance improvement. There's something about going into a laboratory or any situation really, and figuring out where you are. So what's your starting point? What are some of the challenges you have there? And just having a vision for where you want to be and creating a plan to bridge that gap. And so that's essentially the core of what Improves Consulting is all about. And so I'm really excited. So it's interesting how in the middle of the craziness last year, I think it was July when I founded the company, I just had this light bulb moment to actually formalize what I had been thinking for a long time. And so Improve Labs was born, and so we're hoping to assist different laboratories with various consulting needs, whether it's operation support, management support, just sharing our expertise from being in the field for so many years, to see how we can assist different laboratories to better care for patients.
Okay, so would these be laboratories within hospital settings or private? I'm unfamiliar with
Yeah,
the
sure.
laboratory landscape
Yeah, no problem. So
in this
so
context.
there's different settings for laboratories. Like you were saying, there might be laboratories within a large medical center, such as the one where I work for my 9 to 5, or there's the urgent care concept. I'm sure a lot of people are seeing the urgent care model throughout the U.S. It's really popular, especially I think within the last 5 years or so. Different franchises out there that have urgent care centers, they all have a small laboratory inside where when a patient gets a sample collected, there's some things that are sent out to big corporations outside that are, called reference labs. And the results are sent back to the urgent care. But most of the time, they're going to have some kind of testing that's done in-house so they can obtain a quick answer and diagnose the patient appropriately. So the settings could vary. It could be a physician office lab, or it could be a small clinic, or it could be something within a large medical center or hospital.
Okay, I'm going to ask a question here from Chris, but I think you mentioned this, and just for the layperson, did you mentioned CLIA and some these acronyms? Did you mention these?
Yes. So I think
Can
I'm
you tell us
mostly
what these are?
familiar with CLIA. Chris is correct. She's saying that she's very familiar with it. Absolutely. Most laboratories, they're governed or regulated by CLIA law. And so if you have any contact within the laboratory context, you're going to be very familiar with CLIA. So CLIA is the one that designates the different levels of complexity when it comes to testing,
Mm-hmm.
and so it makes sense. Chris is saying she's familiar with it.
Okay, so the complexity of testing and this other one, SAMSA.
I don't recognize the acronym right now. I'm pretty sure maybe if I spell it out, know what
Okay,
she means, but definitely CLIA, I recognize.
okay, and she also asked, "Do you assist with startups?"
Yes, definitely. So we can provide various services. Starting up a small laboratory or a laboratory is one of them. So we come in and do compliance assessments. We assist with startups, and that includes various things, either helping a laboratory with the credentialing, which is a huge piece of a startup, just getting the laboratory started and accredited. Or if the laboratory is already established and you just have projects that you need assistance with and or compliance questions, we also assist with that.
So a laboratory has to be accredited.
Correct.
Oh, okay. See, I didn't know that.
Yeah.
But that makes sense.
Yeah, definitely. That's where the compliance piece comes in. And so there's some laboratories that are accredited by the state. And then you have different agencies, such as CAP, which is the College of American Pathologists, and various other ones. COLA is another one located in Maryland. And so depending on the agency, you know, there's different regulations, and that's where the compliance piece comes in. Different stipulations, all within the CLIA umbrella.
Okay. I have a question here from Engineering Cannabis. There's a lot of talk of automation in these spaces, and he says, with testing, there's lots of automation to eliminate mistakes. What kind of automation do you see? Are you seeing any automation in the clinical labs?
Yes. So so it's interesting this question came up. So in addition to COVID last year, my initiation at my 9 to 5, my current job, was a huge automation project that was ongoing when the pandemic hit. And so as an operations manager, you know, I was asked to take that on and see it fully implemented by the end of the year. And so we transitioned from a manual workflow to a fully automated workflow. And so what we did was we implemented the hardware and then coordinated the software piece of it too. And so whereas before we had a specimen that was touched several times by different people and moved around through several analyzers and several pieces of equipment, now we have a fully connected automation system, and that sample is inputted at the front end and then taken to the back to the various locations to get tested, and then it goes to storage. So that was a huge project that also offered a lot of growth last year, was to implement an automation solution here from a manual workflow. And so it's absolutely right. You know, I think with increased volumes, in particular COVID, you know, and some of the other increases that we're seeing as a result of COVID, automation is key in making sure that we're processing samples efficiently and you know, without mistakes.
So are you predicting that there's going to be more in lab processes, more robots, more?
We have seen a need. I mean, it depends on your operation as well, right? So if you have a small laboratory where your test volume is, you know, very low, then the need for automation might not be there. I think when we talk about automation is when you have large medical centers or hospitals that have a large volume. And so in order for the operation to be efficient, you want to include automation so that the samples are processed, you know, more efficiently accordingly. And so it all depends on the test volume. There are other reasons why people might want to include automation that are not test volume. Maybe the process is too complex and they just want, you know, the robotics or the automation instruments to eliminate those areas where people might make a mistake if we're having repeated tasks, you know, over and over again. But those are some of the considerations that we look at when talking about automation. Not every laboratory is suited for automation. You know, I just want to be transparent with that. You know, a lot of laboratories, if you just have a low test volume, you see test menu is not complex. That's where we see the manual workflow, which is, I think, what most laboratories are familiar with.
Okay. Chris says SAMHSA is another OTP cert. It's mainly used in the substance abuse / toxicology lab.
So it's probably for drugs of abuse and things like that.
Okay.
Thank you, Chris.
Thank you, Chris. Yes. So, Nancy, so in terms of starting Improov Labs, you told us what your motivation was and what you set it up to do. Did you have to, this is for other scientists out there, did you have to acquire any business training to do this, or
to actually do the consulting?
To start your own company?
Yeah, that's interesting. So I didn't. I'm pretty sure that it doesn't hurt if you want to go back to school and like get your MBA. I think that's a goal of mine. If I have time, like I said, I'm a busy mom of two, so right now it's not the time, but maybe down the line, going back to school and getting an MBA might be the thing. But I didn't have any and still don't have any business training. So a lot of business expertise actually came from networking and learning through the salsa community. I think I was telling you
Okay.
there's a lot of benefits of the dance industry, and I credit my business savviness to what I learned there. Just dealing with the dancers and seeing how transactions are made there, and the networking within the dance community. There's a lot of positive things to learn from. But I did not have and still don't have any business training
Okay.
to find. I would say, I think there's this opens up a really important topic. I think sometimes, as scientists, we spend so many years just improving and our technical expertise,
Mm-hmm.
and we don't always understand how to leverage that
Mm-hmm.
into a business opportunity. And so this is something that I've been working on and reflecting on for a few years now, because ultimately we're the experts, right? We are the ones behind the scenes, whether you're behind the scenes or in front of the scenes,
Mm-hmm.
you are the one that has the expertise. And so oftentimes what I find, that has been my experience at least, is that you have us with all this expertise, but we don't always know how to leverage that into a business opportunity.
Mm-hmm.
And so that's when the consulting idea came up. How to take what I do on a regular basis, what I've trained for and worked on for over 20 years now, and offer that to clients independently. And so I think it's been, it's taking a lot of self-reflection and a lot of researching. But I think it's a good thing, and it's a huge opportunity out there.
Okay. Well, the reason I asked, I have a couple of classmates from the University of Michigan Department of
Mhm.
Pharmacology who started their own companies, and I think
Mhm.
at least one of them went and got their MBA.
Yeah,
And you see scientists go ahead and get their law degrees as well.
yeah,
They can do stuff like patent law.
sure.
But I've also going back to what you just said. Many scientists and drug companies, for example, I've heard that they make really good CEOs because they understand the science,
Hmm.
um,
Yeah.
versus a non-science person just running the company.
Yeah, yeah, definitely. I think, once you've been in the trenches, there's a lot of experience there. When I was in the military, you could always tell the officers that were enlisted before,
Hmm.
as opposed to somebody who comes in, no offense to anybody. But it's something about having that background information that allows you to lead in a different way. One of the things that I often say to my staff, when I start managing different groups of people is, I've been in your shoes. So, I know what it is to be a phlebotomist, or, I know what it is to be a laboratory assistant, because if I look back 15 years, 16 years from today, that was me running around, So I think there's a lot of rapport that you create with people when they understand that you know what it is to be in their shoes, and
Hmm.
that you've been down that path too. And I think it provides uh, certain insights for you as a leader.
Uh, I have three comments I'm going to read here.
Mhm.
Then I think this last one you're really going to enjoy. Uh, Ray Alexander says CLIA stands for the Clinical Laboratory Improvement Amendments,
Mhm.
and it regulates laboratory testing and requires clinical laboratories to be certified before they can accept human samples for diagnostic testing. Thank
Absolutely
you for
right.
that, Ray.
Yeah.
Okay. Let's see. He says three federal agencies are responsible for CLIA: the Food and Drug Administration, the Center for Medicaid Services,
Mhm.
and the Centers for Disease Control and Prevention. See, I'm learning so much here.
I
Um,
know. I think we're both learning a lot from the other, but Ray Alexander is absolutely correct.
Ray's very thorough. Yeah. So this is the question you'll probably enjoy, Nancy. It says, Chris says, is it okay to send Nancy's info to a doctor in Atlanta? She wants to open a lab there and already has the location.
Absolutely. So I don't know if you
I
want
put
to
your link below.
share my information with Chris. So we have a website. It's called improovlabs.com. Improve is spelled funny. It's IMPROOV. And would love to talk to the doctor in Atlanta and see how we can help them out.
Yeah, everyone, this is below in case you want to go take a look for yourself and read about Nancy's company. That's right there.
Thank you.
So, all right. So I'm going to
a lot of great questions for from the audience.
Yes. I have a lot.
Sounds like you have a few experts too.
Well, yeah. I didn't know they knew all this. Let's see. Salchi says insider information can create an edge. I think he's talking about
create an edge. Yeah, absolutely. And I think I was saying that when I went into laboratory management, I feel that's when my career really took off. I think I know it comes natural to me to just manage people. I feel like if you love people, you can manage people better. And so I tend to say that I like to focus on people, not on processes so much. You have to have a good balance, as a manager, as a leader. You can never really look at the task and the process isolated from your people. And I think that's a huge learning for me as I was coming up, through the ranks. Is no, these things go hand in hand. We cannot worry about the process isolated from the people. And so managing people, it's a whole other philosophy within the lab context.
That's right. Okay, we have about 18 minutes left. I want to be respectful of your schedule. Let's see. So again, in terms of your end user, it's labs that need to get certified or need to stay certified. Okay. So
there's various needs. So, a laboratory may reach out to us if they need assistance with starting up a lab, as Chris was mentioning. So there's the credentialing piece there, making sure that the equipment that is purchased is the adequate one for the testing that is desired. So there's a lot of work that we do in the startup side of things. And then if you are part of a laboratory that's already established, then we can assist with compliance review. So before laboratories get inspected, they often want to do what's called a mock inspection. And that's nothing than a group, an objective team coming in and doing a pre-inspection of your processes and your systems and providing to you a report that says, hey, these are things that you might want to look at before an inspector walks in through your door and actually issues you a citation, right? And more importantly, I always want to take it back to patient care, which is very important. And so we are able to provide that. So that's a compliance assessment as well. Some laboratories might need assistance with document control, implementing a quality management system for the lab. What are the things we need to look at, provided our test menu, for us to make sure that we're running a quality operation. There might be some issues with a particular process that you may want us to look at, and we might be able to offer suggestions on how to make that process more efficient, how to eliminate waste from the process, etc. So there's various things that we can assist with. And if people go to the website and then just click on the services tab, they'll be able to see an outline of all the services that we provide.
Okay. All right, everyone, if you have more questions for Nancy, throw those in the chat now. I have one left. And again, I want to be respectful and cognizant of her schedule. Where do you see Improov Labs going in the future? I mean, I know that's an open-ended question, but any thoughts on that?
Yes, I love the question. So even though Improov was just founded and we're trying to get the word out about who we are and what we do, and our first goal here is to get us on board in terms of compliance assessment and help with starting up a lab, etc. I do see an education arm within Improov in the near or far future, depending how things progress. And so one of the things that I noticed is, and I think a lot of the folks that are in the chat can probably attest to this, in various science and laboratory fields, is the need for more education for either professional development in the science field. And so my hope is to develop an education arm within Improov to provide, whether it's educational courses or webinars that talk about the particular needs of the scientists in terms of professional development. So that's my vision for Improov.
Okay, are there needs? Are there things that you're seeing that are missing from individuals working in these lab settings?
So for example, if you have a science person move up into a management area, oftentimes, unless you're the type of person that went back to school and got your MBA, there's a lot of management concepts that we might not be familiar with. And all of a sudden you find yourself, either as a supervisor or as a manager, having to have all these skills that are not part of your technical education, right? So time management, conflict management, communication, leadership, all these things that are part of your toolbox or should be in order for you to do your job more efficiently as a laboratory manager or as a management person in general. So I think there's a lot of opportunity in there to help technical professions or technical professionals rather move into management positions and develop the skills that are going to make sure that you're going to be successful in management.
Okay, so it sounds like the soft skills, managing teams, managing personalities,
Yes.
conflict resolution,
Which
planning.
closure, it's not in general. I think science folks, we tend to focus on the technical aspects of
Yes.
things, right? And so what I learned when I was coming up through the ranks is that, yes, the technical aspect is hugely important because at the end of the day, I need to be able to analyze that test. And I need to be able to, I think you say you're in pharmacology, you need to be able to analyze your data and so forth. But what's going to move you forward, what's going to make sure that you're successful in that next level in your career, whatever that is the soft skills. And I feel that there's not a lot of, well, now I think there's a lot more opportunity to learn soft skills because the knowledge industry is really growing in terms of, the amount of information that's available online, the webinars, Zoom conferences that you can join, etc. But at least I know when I was coming up, it's like, okay, where am I going to go and learn this? And it's something that takes time to develop as well. I feel like unless it's different from your technical aspects. I can tell a scientist any day, okay, this procedure is done this way, and there's a recipe for it, and you just follow the instructions. But when it comes to the soft skills, as we all know, the emotional intelligence, the communication, body language, verbal, nonverbal, all those things, they're not as clear, they're not as explicit, and so it takes time, it takes maturity in the person as well to understand and grow in that arena.
Yeah, I'm a little tickled here because professors, at research institutions like the University of Michigan, they're known for being very smart,
Mm-hmm.
but sometimes their soft skills aren't there.
Yeah, and you know what? I think it really goes back to not utilizing the skills. The first, not being aware, and then not utilizing the skills often. So it's really easy to just go into a lab and just focus on your tasks, focus on the processes. And as I was mentioning earlier, I think when you get into management, it's really important to understand that people and processes, they're really side by side. And if you ask me, I always put people a little bit higher than processes, because I feel like once you have that emotional intelligence and you're able to manage people better, then your processes improve naturally.
Okay. All right. Looks like Chris left a comment for me. It says, Dr. Dunbar, you should consider consulting your services to labs by being a lab director. That's interesting. All right, Chris, I'll give that some thought. I never thought about being I guess with the experience I have on the regulatory side, I might be able to jigger that somehow. So, in any case, we're at 50 minutes. Oh, there was one more here, Nancy. This is technology related. It says, Salchi says, nope, that's the wrong one. Oh, in the future, will wearables, parentheses, the iWatch, be used for live medical data? Do you
Is
know
he
anything
talking
about
about the metaverse, maybe?
that? Maybe.
I don't know.
I'm thinking about one of those gadgets that Apple has, where I guess we're talking about reading vital signs, real time.
Listen, I'm a fan of technology. I'm always checking out what's next, when it comes to technology and healthcare. I think that's an interesting niche, the technology and healthcare as well, for those that are interested. Just the other day, I had to take my son to the doctor, and I have an app that I downloaded that's linked to his medical record from the hospital. So as soon as his test result was ready, I got a little notification on my phone, and I knew what was wrong with my son before the doctor called me back. And so all of that is thanks to the improvements in technology, healthcare IT that are going on. So.
Okay. All right. Well, Nancy, do you have any other anything else you want to say? Any parting comments or thoughts or anything?
Yeah, well, thank you so much for having us. I really appreciate the opportunity to share a little bit more about me and about Improves and what we can do for laboratories. Probably my parting words would be about recognizing or raising the awareness of laboratory professionals in the field. It's a work that a lot of colleagues are engaging on, and I
Mm-hmm.
think that over the last year and a half, certainly with COVID, the laboratory industry has kind of come under the spotlight. And I think it's one of those things where it's like it's about time, because a lot of people don't know about us and the work that we do. We share statistics here and there where it says that 70% of the decisions that are made by physicians to diagnose patients is really based on laboratory data. So that's just to give you an idea of how important our work is when it comes to patient care and making sure that we get the right diagnosis out there and therefore the right treatment, right?
Mm-hmm.
For patients. So my parting words are just about the look up, laboratory professionals, share with people, how wonderful of a field this is. We have a lot of shortages. There's a lot of laboratory professionals that are retiring soon. And so if you look across the country, there's several laboratories that are hurting for staff. So whether you are a laboratory professional or have that education that can go into one of our fields and might be interested, or if you know somebody who's starting to look for degrees and interested in healthcare, mention laboratory profession to them, and just help us raise the awareness about this wonderful profession.
Okay, that's excellent. All this is the website for Improov Labs. It's below in the description box for the playback of this video in case you want to go take a look. And please do go take a look, because it also shows what you can do with your science training. You can start your own company, you can start your own vision and your own enterprise. But I think what Nancy just touched upon is was one of my reasons for starting this channel, in that there's a need for lab professionals. So the workforce is turning over, and there's going to be a need for people with these skill sets and these knowledge sets. So unfortunately, this we go to the doctor all the time, but many people don't know that this sector exists.
Yeah, definitely.
Yeah. Okay. Well, let's see. Chris says, and then we're going to shut this down. Chris says, yes, laboratory professionals are much needed. I've held seats on different boards for health plans and states. So that has been a discussion the past years.
Yeah.
So Nancy, I'm just going to show a picture really quickly. So in some of my content, I do show one of the reasons that I make content sometimes about, for example, that's the wrong one. What a Western blot is. These are all diagnostic tools. What cell culture is. What all these things. Chemiluminescence assays.
Absolutely.
These are all diagnostic tools that medical professionals use to diagnose patients and disease states. So it's important to know what these things are and to also trickle the messages out to young people who need to know them.
Yeah, for sure.
So, okay, well, yeah. So we will conclude right there. So Nancy, thank you so much for coming on and talking about your background and what Improov Labs is and how you started it. Hold on, we have one more here, and I think since you're here, we'll just squeeze this last one, and this will be a short one. It says, what college courses do lab professionals draw on the most?
Sure. Thank you so much for the question. So general science, so your anatomy, your biology, there's different ways you can become a lab professional as well. So maybe I can share some information with you and that can be distributed. But in terms of the specific courses within the lab field, so then you would study, chemistry, your hematology, your analysis, microbiology, etc.
Okay.
So there's a lot there.
Okay. All right. Well, everyone, we're going to stop this here. So please like, share, and subscribe. Thank you to everyone who watched this live. If you're watching on the playback, please like, share, subscribe. If you want to make a donation to the channel, that information will be below in the description box. In addition to Nancy's website, please go and take a look. And I believe your contact info is there if people want to ask you questions.
Yeah, definitely. I'll be happy to answer.
Well. Okay.
Thank you so much for having me. I appreciate all the questions. Thank you.
Thank you, Nancy. Yeah, we'll talk some more offline by email afterwards. Everyone, I'm going to take us out with the music and the slideshow intro again. So Nancy, we'll thank you. We'll talk again soon.
Thank you.
Okay.